Osteoporosis. Diagnosis and treatment. Osteoporosis is a bone disease characterized by low bone density and the deterioration of bone tissue, leading to fragile bones that are prone to fractures. It is often called the silent disease because it can progress for years without causing any symptoms. Osteoporosis is a common condition, particularly among older women, but it can also affect men. Osteoporosis is caused by a combination of factors that affect bone density and strength. Some of the main causes and risk factors include: 1. Age. Our bones become less dense and more prone to fractures as we age. 2. Gender. Women are more likely to develop osteoporosis than men, especially after menopause. 3. Genetics. Osteoporosis tends to run in families, and certain genetic factors can increase the risk of developing the condition. 4. Low calcium and vitamin D intake. Adequate calcium and vitamin D are necessary for strong bones, and low intake of these nutrients can increase the risk of osteoporosis. 5. Physical inactivity. Lack of weight-bearing exercise or physical activity can cause bones to become weak and lose density. 6. Certain medical conditions. Certain medical conditions, such as hyperthyroidism, inflammatory bowel disease, and some types of cancer, can increase the risk of osteoporosis. 7. Medications. Certain medications, such as corticosteroids, can weaken bones and increase the risk of osteoporosis. 8. Smoking and alcohol use. Smoking and excessive alcohol use can interfere with the body's ability to build and maintain strong bones. It is important to address these risk factors early on to prevent or slow down the development of osteoporosis. How is osteoporosis diagnosed? Osteoporosis can be diagnosed through a combination of medical history, physical examination, and imaging tests. Medical history. Your doctor will ask you about your medical history, including any family history of osteoporosis or fractures, any medications you are taking, and any other medical conditions that may affect bone health. Physical examination. Your doctor may examine your posture, height, and overall physical condition to look for signs of bone loss or fractures. Imaging tests. The most common imaging tests used to diagnose osteoporosis are dual-energy X-ray absorptiometry or DXA scans. These scans can measure bone density in the hip and spine, and can detect bone loss before a fracture occurs. Other tests that can help diagnose osteoporosis include ultrasound, computed tomography, CT scans, and magnetic resonance imaging or MRI scans. Blood tests. Blood tests can be performed to check for conditions that can cause bone loss, such as thyroid disorders or vitamin D deficiency. If you are at risk for osteoporosis, your doctor may recommend screening tests to check for bone density. The frequency of screening tests will depend on your age, sex, and other risk factors. It is important to talk to your doctor about your risk for osteoporosis and what screening tests may be appropriate for you. Medications for osteoporosis. There are several medications available to treat osteoporosis, and the choice of medication will depend on your individual situation and medical history. Some common medications used to treat osteoporosis include: 1. Bisphosphonates. This class of drugs helps to slow down bone loss and increase bone density. Examples of bisphosphonates include alendronate, risedronate, and ibandronate. 2. Hormone therapy. Hormone therapy can be used to prevent or treat osteoporosis in postmenopausal women. Estrogen therapy is the most common type of hormone therapy used for osteoporosis. Selective estrogen receptor modulators or SERMs. These drugs mimic the effect of estrogen in some parts of the body, such as the bones, but block its effect in other areas, such as the breast. Raloxifene is an example of a SERM. 3. Calcitonin. This drug is a hormone that helps to slow down bone loss and can be used in women who are at least 5 years past menopause. 4. Denosumab. This is a monoclonal antibody that helps to slow down bone loss and increase bone density. 5. Teriparatide. This drug is a synthetic form of parathyroid hormone that helps to stimulate bone growth and increase bone density. Talk to your doctor about the risks and benefits of these medications, as well as any potential side effects. Your doctor can help you choose the medication that is best for your individual situation. Osteoporosis and mental health. Osteoporosis can have a significant impact on mental health, particularly in older adults. The physical limitations and pain associated with osteoporosis can lead to feelings of depression and anxiety, and the risk of falling and sustaining a fracture can also cause fear and anxiety. In addition, some medications used to treat osteoporosis can have side effects that affect mental health, such as mood changes and memory problems. On the other hand, depression and anxiety can also contribute to the development and progression of osteoporosis, as stress hormones can interfere with bone-building cells. It is important to address both physical and mental health concerns related to osteoporosis. Exercise, particularly weight-bearing exercise, can help improve bone density as well as mood and overall well-being. Counseling or therapy can also help individuals manage feelings of anxiety and depression related to the condition. It is important for individuals with osteoporosis to talk to their doctor or healthcare provider about any mental health concerns and to seek appropriate treatment and support.